Hi, I'm Dr. Lawrence Glassman, board certified by the American Board of Plastic Surgery, and today we're going to talk about rhinoplasty. So let's get right into it. What is a rhinoplasty? Essentially, a rhinoplasty is an operation on the nose, and what we're doing is really two different things. One, most often we're operating to make the nose look better, and what's better? It's often what the patient wants their nose to look like. Some people's nose too big, too small, crooked, kind of an odd shape, the tip is broad. All those things we can improve in surgery. Our second goal is some people have breathing problems and we're operating on the inside of the nose to make the breathing better. Now, why do people have breathing problems? Well, sometimes the breathing problems are from trauma. They were hit in the nose was broken, the inside of their nose is crooked, and we need to straighten it out. The other possibility is some people are just born with difficulty breathing through their nose because of something genetic or developmental that causes their airways to be narrow or their airways to be weak when they take a breath. Their nose actually collapses and doesn't let the air in. All those things we can improve. Now, there are a number of types of rhinoplasty, but let's separate into two major categories of rhinoplasty. The first is what's called a closed rhinoplasty. A closed rhinoplasty is one that all the incisions are on the inside. The second one is what's called an open rhinoplasty. An open rhinoplasty also has incisions on the inside, but it also has one small incision on the outside that's right on the bottom of your nose. Now, what's the difference between these two operations? In an open rhinoplasty, with that incision, we're able to see the anatomy much better and are more easily manipulate your cartilage, your bone, to improve more complex operations. Now, there are some plastic surgeons that only do closed operations, and there's certain plastic surgeons that only do open rhinoplasty. I do both. My preference is to do a closed because there's no outside incision. But certain operations, I find that I can get a better result doing it open. So on those patients, I do an open. Let's talk about that scar on the open rhinoplasty. Usually in a few weeks, it's very hard to see. And often when I'm seeing my patients in 6 months, I can't even see it. I know where it is, but I can't see it. The bottom line to this, you can get a good result with both techniques, and every plastic surgeon is going to pick the technique that works best to give you your result in their hands.